I'm Dr. Sarah Keep from By Design Optometry. We are a local optometry clinic located in West Edmonton. We do provide comprehensive eye exams and routine eye care, but we're also providing vision therapy in Edmonton. So today we're going to take a little bit of time to talk about some of the services we provide for vision therapy. We'll talk about a specific disorder that's really common, and we'll talk about some treatment options. So I'm really excited to give everybody some information on what's available for vision therapy in Edmonton. A lot of people don't realize that 1 in 4 children actually have a visual disorder that's undetected. The problem with this is once they start school, so much of what's required for learning involves visual information. So 80% of the information that's gathered in the classroom is visual information. So it can have a significant negative impact on how a child performs in school. So it is something really important that we always like to spend a little bit of time focusing on during our routine exams to make sure that even if a child doesn't require glasses, or even if they can see 20/20 with those glasses, that they don't have other visual issues that could actually affect the way they're performing in school.
Can you tell us a little bit more about what convergence insufficiency is?
For sure. So convergence insufficiency is one of the most common conditions that we actually will find in patients. So a convergent eye movement is when you look straight ahead, your eyes are pointing straight. When you look up close, both eyes have to move inwards to be able to both be pointing at the target. So that inward movement of the eyes is called convergence. So convergence insufficiency is basically an inability to be able to properly move both eyes inward and keep them aligned on that target.
Nice. And what are some of the symptoms you look for in convergence insufficiencies?
Convergence insufficiency causes symptoms associated with near work. So they can be anything from blurry vision up close to eye strain or headaches. The words can look like they're kind of moving in and out on a page. Patients can have difficulty maintaining focus up close. They can have issues with attention or comprehension from reading. Other patients actually don't complain of symptoms at all. So their brain has just learned to ignore the symptoms, or they can avoid near work altogether. So it's not uncommon for a child to have convergence insufficiency and actually not have any complaints at all. So,
and is it possible to have a normal routine eye exam with normal results and still have convergence insufficiencies?
Yeah, it is possible. So one of the tests that we do for convergence insufficiency is called the near point of convergence. So basically what that is you hold up a target, you bring it in closer to the patient's nose, and it moves their eyes in and in and in, and they have to maintain focus on that target. The problem with that test is when you only do it one time in the exam room, if you have an inefficiency in your ability to converge, you might be able to do it that one time because it's not really a significant demand. So I have had patients where they have complaints that point to convergence insufficiency where if you do that test and you actually repeat that test a number of times, that's when you'll actually start to notice issues with convergence, because as their visual system starts to fatigue, the test results will actually change. So oftentimes I'll repeat that test a number of times, or we do it in a different way where instead of using a specific target, we'll change up the target. You really kind of need to dive a little deeper to see if these patients do actually have an inefficiency to their conversion system, because it's so easy to miss in a routine eye exam.
Okay.
Yeah.
And what should I do if I suspect my child does have convergence insufficiencies?
The biggest thing I would suggest is make sure that they have their eyes tested, and if you've had a regular routine eye exam and still feel like your child may be experiencing symptoms associated with convergence insufficiency, maybe consider having a full visual efficiency evaluation done. During this exam, we dive a little bit deeper and do a number of different tests on the functioning of the eye muscles and the visual system, to see if there are issues with convergence, but other visual skills as well. So oftentimes that more comprehensive exam is really required to be able to detect disorders with the visual system. So I always educate patients, if you still are really certain that there might be issues with your child's eyes, and you've had just a regular routine exam and everything's normal, that doesn't necessarily mean that everything is completely normal. It just means that the test that we test for during a basic eye exam were normal, but not necessarily every visual skill was addressed.
Okay.
Yeah.
And how is convergence insufficiencies treated?
So the number one treatment for convergence insufficiency is active in-office vision therapy. So vision therapy is extremely successful for treating vision therapy. There was actually a study done called the Convergence Insufficiency Treatment Trial that tested the effectiveness of vision therapy, and luckily it's very effective at completely resolving convergence insufficiency. So that's typically my primary recommendation for patients, is to go through and do a formal vision training program where they actually will come in and do in-office sessions, because it's relatively easy to treat convergence insufficiency, and once it's treated, you have that as a visual skill. So we don't have to go through and prescribe things like lenses or prisms and stuff like that, which is more equivalent to prescribing a crutch for a broken leg. They might temporarily alleviate symptoms, but they don't actually address the underlying problem. So we certainly want patients to consider actually fixing the problem by doing a vision therapy program.
And what kind of activities are involved in a vision therapy program for convergence and insufficiencies?
All sorts of things. So obviously the primary purpose for the activity is to teach patients the skills to be able to converge their eyes or move them in, as well as diverge their eyes and move them out. So we do spend a lot of time training these as skills. But we will also go through and make sure that they're efficient in other visual skills as well. So we do focusing activities and tracking activities, and we'll do balance activities and make sure that they have awareness of their peripheral visual system, and do bilateral body movement activities. So there's a number of different activities that are involved in a vision therapy program.
And what change can I expect to see in my child after they have completed a vision therapy program with you, Sarah?
The change can often be dramatic. I mean, we've had patients say that they feel like they have a brand new child after they complete a vision therapy program. So children are often much more confident. They will go from absolutely hating school and complaining about doing homework and reading and avoiding it at all costs to absolutely love reading, and they're confident now that they can actually do it successfully, and it's not a huge burden on them to be able to actually read. So a lot of the visual skills that we train will actually translate to other aspects of their lives as well. So some children are less clumsy and they perform better in sports, or because they're more confident, they have benefits in social aspects of their lives and stuff like that as well. So the changes we can see from vision therapy can actually be quite profound.
Yeah. And does convergence insufficiencies only affect children?
No, so we've had patients at a later age who have convergence insufficiency as well. So sometimes it's patients who've had it since childhood and it was either not detected or not treated. We have had patients where this is the case, and now they have a job where it's really demanding on their visual system. They spend long hours on the computer and it's just not comfortable, and they're experiencing a lot of eye strain. And to do a vision therapy program, they are just able to perform much more efficiently and comfortably at work. So that's certainly a possibility. You can also develop convergence insufficiency. So patients who have certain medical conditions, or if they take medications, or if they suffer from a traumatic brain injury, for instance, you can develop a convergence insufficiency later in life that can certainly cause a number of symptoms. So it can really be something that affects anyone at any age.
Okay. Sarah, can you tell us why convergence and insufficiency would cause difficulty with learning?
Yeah, of course. So one of the reasons why children often will have difficulty in school is just because it's challenging to actually gather the visual information. So what happens when a child looks at a page and their eyes are not focused on the same point and their eyes are kind of moving in and out, the words on the page actually will move in and out as well. So you can imagine that if you were experiencing, text in a book that, wasn't stable and stationary, you would have a really challenging time actually understanding the information that you're trying to process. So children can have difficulties in school just because it's so challenging to actually gather the visual information. So it would be like trying to do a race with a broken bicycle, for instance. there's great challenges to be able to do that effectively if the visual system is not working adequately.
Okay. And lastly, how do I book an appointment if I'm interested in having my child assessed?
The easiest way to book an appointment is to call our office. So we don't schedule our visual assessments online. So if you wanted to book a comprehensive appointment, you can certainly just do that independently through our online portal. But if patients are wanting to book a visual efficiency exam, they do actually have to call our office. We typically have that set up with our vision therapist who can coordinate the appointments. So the best thing to do would be to call the office at 780-444-6407 and to talk to one of our staff to get started.
Thanks, Sarah.
Yeah, you're welcome. I hope that provided a little bit more information about vision therapy in Edmonton and the services that we provide here to the community. If you have any questions, feel free to call our office. We're always happy to assist patients. And if you feel like this is something that is bothering you or your child, don't hesitate to book an appointment. The effects of a vision therapy program can be really outstanding for patients and their performance. So thanks for joining us.